An air ambulance is landing with a young man badly injured in a car crash during cold and wet weather.
Is it really cold in here today?
It's freezing. I've had to put extra gowns on.
Senior emergency Dr Johnathon Papson is standing by with his trauma team.
Sounds like he's gone surfing, he's come back in the rain. Someone's just pulled out ahead of him and he's crashed into the side of them. He's been trapped in his car. He's been stuck in there for half an hour.
Usually when it comes via helicopter, it's pretty serious. It's a serious deal.
Oh, here we go.
24-year-old uni student Taylor was pinned in his crashed van in freezing conditions and is in a lot of pain.
We're going to move across and have a look at you, mate. All right? You feeling okay?
Oh, yeah.
Yeah, good.
Yeah, a bit better.
1, 2, 3. All right, 1, 2, 3.
So Taylor's normally well, driving a high ace van, T-boned a car that came in front of him. He's got full recollection of the event. He was trapped for about 40 minutes. The first ambulance crew arrived, so he was sort of spread eagle over the top of the steering wheel with his chest resting on it. There is some damage to the steering wheel as well.
Okay, all right.
Injury-wise, is apart from a little bit of bleeding from his nose, there's no obvious injury to his face, to his head. Neck's got no pain.
He's got the wound on the leg.
Is an injury in there, which looks like a bit of dashboard's gone in and out again, and just a steady ooze of blood coming out of it. He has a little bit cold because it was quite cold.
Yeah, cold and wet.
Taylor's very lucky. A lot of people wouldn't survive this sort of crash, especially with country road, high speed, wet conditions, older car, you know, roll the dice.
Taylor's father arrived at the crash site as his son was being cut from the van. His parents are on their way.
Does that hurt? No. Did you hit the steering wheel with your chest?
Oh, I'd assume the airbag didn't go off, so...
You had a seatbelt on?
Yeah.
Does it hurt when you breathe?
No.
No. Did you hit your face on something?
Probably the steering wheel.
With no other obvious external injuries, Dr Johnathon turns his attention to Taylor's leg, which had been bent up against and then pierced by the dashboard of his crashed van.
So it's probably broken, isn't it? A little bit of ooze coming out.
Is that sore, mate?
No.
Looks like an open fracture bleeding.
So an open fracture is where the fractured bone is exposed to the environment, which means it's just going to get infected unless you do something about it. And it's a bad thing to happen.
The injury is potentially devastating for Taylor, who works as a surf coach and has important uni exams coming up.
And your leg's quite sore, yeah?
Yeah, both of them.
Yeah, both.
What about those toes? Well, yeah, that's my big toe. The toe's really sore, and the next one.
Both toes numb? Both feet? Or one?
These are sore, those are kind of numb.
Does that hurt?
No.
For something like this, what are the real problems going to be? It's going to be chances of infection. Is there a problem with the blood supply to the toes? Has the main artery down there been compromised by the fracture, by the bones moving?
So the fastest looking normal and the chest looks normal.
If it's an open fracture, which means he's got bone poking out, then there's always a potential of amputation. So there's always a potential that he's going to lose his leg. That's the real deal here.
How old are you?
24.
Over in Trauma 1, Dr Johnathon Papson's patient Taylor is waiting for the X-ray results of his right leg, which was severely injured in a car crash on his way home from the beach.
Because you're going how fast? Like 80, 100 or?
Oh, realistically, probably 90.
90, yeah.
The X-ray results are ready and confirm Dr Johnathon's suspicions.
So he's got a fractured shaft of the tibia, which is not a good injury to have. Because it's open to the environment, you can get an infection from there. So it's actually quite a serious injury to have. If it gets infected, that's big trouble.
It's a broken bone under there.
Yeah, right.
And you can tell because you see how the blood's like a little bit fatty? It's probably coming from the middle of the bone because it's got marrow.
Johnathon calls in specialist orthopaedic surgeon Dr Patrick Elias to see what can be done to save Taylor's leg.
Looks like it's open, so it's a grade 1. This is pretty significant injury, and the complications associated with this can be limb-threatening. So we need to do an operation on this as soon as we can and insert a metal rod down the bone and use some screws to secure that rod.
We're giving him antibiotics. We're going to wash it out, but there's still a high chance this leg of his is going to get infected.
Just a wave with me?
Taylor's parents, Maury and Joelle, have arrived to see their son.
So you guys just give us heart attacks, you do? Which one? You and your brothers?
Taylor phoned his dad while he was still trapped in the van.
I was doing some gardening and the phone rang, and Taylor just said, "Dad, I've had a bad accident and I think I've broken both my legs." I said to him, "Call an ambulance," and he said, "We already have." And then he told me where he was, so I said, "I'm on the way." Driving down there, I tried to ring him back and he didn't answer his phone. That's where I was thinking something terrible's happened. I got down there and, there were police and ambulance, everybody all around the place. And the car was just absolutely written off. He was pinned, his legs were pinned in the van, and it took them a while to cut him out. They had to obviously cut the van and that, and he was in a fair bit of pain. It was cold, it was raining, it was just a shocking day.
People lose their legs all the time in crashes like that. I've seen the van, he could lose his leg. We will do everything we can to make sure that doesn't happen.
Any questions about it?
Orthopaedic registrar Dr Timothy Chung prepares Taylor for the major surgery he's facing.
There's some risks involved. Our hope is to give you one operation, which is rods, then recovery of about 6 months.
It's overwhelming news for the surf coach and uni student whose life will be dramatically changed by the accident.
So, what do you do for work? Surf coach, but I'm a student. So you're about 6 months away from being able to surf.
It's going to be awful for him not to be able to do what he loves doing. It's totally unexpected. It's come out of the blue. It might be totally devastating for him. That's his job.
Doctors will need a CT scan of Taylor's broken leg to see the full extent of his injury before he goes to surgery.
He's going to have pins and an external device put on his bones to hold the bones in place. And then he's got a wound there that needs to be cared for, and then you've got to worry about all the other things, the tendons and the arteries and the nerves that might have been injured as well. So it's much more complex.
Dr Johnathon Papson's patient, Taylor, is being prepared for major surgery. The 24-year-old surf coach is in danger of losing his leg following a serious car crash. Taylor's badly broken limb is being wrapped in plaster to keep it stable until he goes to theatre.
Trouble is when you lift the leg up, the bone sort of sags a bit, and that obviously hurts. You remember the fracture, there's a jagged bit. So I don't blame him for being uncomfortable. So I can hold the plaster if you want to get the bandage. So you've got the foot.
Any lower limb injury that's open to the environment, if it gets infected, you lose the leg or you lose part of the leg. That's the real risk. So there's a risk of infection, and even despite antibiotics and the best possible treatment, it can still get infected.
But we just have to have it like that because it needs to be in the right spot.
His dad, Maury, is worried about the impact on Taylor, who's studying environmental science and about to sit exams.
There are some memories in my mind, some pictures in my mind that will stay with me forever. Just below the vehicle, there was this puddle of oil and blood and rainwater all mixed in, and that was just a horrible thing to see. It'll be no different for Taylor, though. He'll have some horrible memories as well.
Someone's looking after me. I saw a picture of the car and it's amazing I've still got legs left, to be honest.
Dr Johnathon has done all he can for Taylor. He's now going to theatre for surgery to try and save his leg. When surf coach Taylor was airlifted to emergency with a shattered leg from a high-speed crash, Dr Johnathon was concerned there was a risk of amputation.
If it gets infected, that's big trouble.
Jonathan cleaned and plastered Taylor's badly broken leg before an operation to try and save it. 3.5 months later, the uni student isn't back riding the big waves yet, but he has managed to dip his toes in.
So I went from not being able to take a single step, and then I actually went for my first surf yesterday. So that was pretty exciting.
His leg was saved after marathon surgery, where a titanium rod was inserted from his knee to his ankle.
This experience definitely has changed my outlook on life. I think this accident has strengthened my relationship with my dad. Like, he found it really difficult to be at the accident site and to see me in that situation.
It probably gives us a good outlook on life now. One of the police guys at the thing said to me, you know, someone up there was looking after him, and, you know, we truly believe that.
As night falls, another air ambulance is coming into land on the Royal Melbourne Hospital's rooftop.
Hi there, it's Michael in emergency. We have a trauma coming in with some portable x-rays when they come around, so...
Dr Michael Dunn's preparing for a seriously injured man who's been crushed by a quad bike.
He's been ketamine and propofol drawn off in case he's in absolute agony.
50-year-old Len was out with a group of mates having his first ever quad bike ride when he crashed at high speed. He was catapulted over the handlebars and trapped under the 300-kilo bike when it landed on top of him.
With quad bike or motorbike accidents, we are concerned about spinal injuries and significant head injury because the patient's not harnessed in like they would be in a car. So something we need to be particularly wary of.
Hi guys. Do you want to do a hands-off handover and just get the story? Then no worries.
Len's injuries may be very serious, and his wife and children are unaware he's been airlifted to hospital.
This is Len. He's been riding a quad bike around about 4 o'clock today with some friends when he states he was going around about 75 kilometres an hour when his front wheels have impacted a ditch, which has caused the quad bike to sort of flip up and throw him forward from the quad bike. We believe that he's then landed on his head with an impact that's quite significant, causing his helmet to actually crack.
Oftentimes, the knee-jerk reaction is to jump in and start examining the patient and checking them head to toe. Handover is when we get a full story about the patient and what the paramedics have found. Without the actual story to give a context, things can get missed.
He's got significant deformity over to his left shoulder, significant pains to his central spinal region around T1.
Is that all right?
Hello. My name's Alison, one of the trauma doctors. Lynn's going to move you across.
1, 2, 3.
Well done, Lynn.
Left shoulder, possibly clavicle or anterior dislocation, back and head injury, GCS 15, hemodynamically stable, chest, abdo, pelvis fine.
All right, our lister's just going to pop in and have a quick listen to your heart and lungs, and I'm going to do an ultrasound at the same time, okay? Keeping that head nice and still for us.
Taking nice deep breaths. That's okay.
Whenever we have someone coming in with high-speed accident, our main concerns are life-threatening injuries. Things we'll be looking for would be fluid around the heart, collapsed lung, some bleeding around the liver or inside the abdominal cavity.
Any pain here in the pelvis? No.
Good air entry. You just feel like a noggin in your head.
Shoulder, you think that's...
Let's have a good feel of the clavicle.
Dr Michael begins examining Len's injured shoulder.
Sore there, is it? There.
From examining Len, we can tell that there's some deformity around the collarbone. So the X-ray will help guide us to see exactly what the level of injury is.
Yeah, he's fractured mid-clavicle there.
Yeah. Whenever someone gets a significant impact to their side, either the shoulder is going to be injured or the collarbone will take the brunt of the force. So it is quite a painful injury because whenever you take a deep breath in, the collarbone will move and that will cause pain.
The X-ray confirms a badly broken collarbone, but it doesn't show if Len has spinal injuries.
What's the sorest bit at the moment?
It's in my back. I don't know what's wrong.
Who was with you at the time? Just keep your head nice and still, okay? You're doing a good job.
2 friends.
Okay. And what happened there? Did they help you walk, or did you have to wait for an ambulance? Couldn't get up.
My legs are
Back's going to be a little bit concerning if he hasn't moved since.
Can you wiggle your fingers in this left hand, please? Does anything feel numb at the moment in the hands?
Yes.
In this situation, we're very concerned about Len's spine, particularly given the degree of pain he's in.
We're going to roll you onto your side and have a feel of your back, all right?
Back in trauma, Dr. Michael Dunn's seriously injured patient Len is lucky to be alive after a high-speed ride with mates went horribly wrong.
Now, this will hurt.
The father of two was riding a quad bike when he hit a ditch and was thrown into the air, landing on his head.
1, 2, 3.
He was pinned under the bike and has suspected back injuries.
Is there anything sore at the back of your neck?
Yeah, very sore. Yeah.
So the main thing was at the base of your neck.
C7, yeah.
You're pretty sore over the base of the neck there at the spine. A little concern there might be a crack there. You let us do all the moving. 1, 2, 3.
We're concerned about a spinal injury. The worry is that the bone may be unstable, and any movement he may do will actually cause some injury to the spinal cord or surrounding nerves. So it's quite important that we keep Len completely straight and immobilized until we can ascertain, is there any significant unstable injury?
If we could just give CT a call and let them know we're coming around.
Dr. Michael fears that Len's spinal cord may be damaged and he could be paralysed permanently.
Do you quad bike a lot, do you?
No, motocross. Two-wheelers. We were short one motorbike. I decided to hand my bike over to a friend and, I rode the four-wheelie. Bad decision.
This has obviously been a very traumatic injury for Len.
Until we get this collar on and get the orthopedic surgeons, I want to keep your head basically and back flat.
While we do focus on the treatment and the medical side of things, it's also important to see that this is going to affect their life moving forward. So a large aspect of our job is to be able to reassure patients and get them on the right track.
Len, we're watching you the whole time because you need us urgently. There's a microphone in the machine, okay?
I suspect that he might have a fracture of his lower cervical spine, which is the base of the neck. And given the mechanism, the fact that he was going 75k and came off, there is a chance he may have something in the brain.
There, he's come through the back.
One of the spinous fracture. Yeah, he does.
The CT scan reveals he's broken his back in 4 places, fractured his ribs and punctured his lung.
Len has multiple fractures to his spine high up and also around the mid-back area. I think that given the fact that Len went over the handlebars and landed on his head, that potentially could have led to a significant head injury, and he's extremely lucky he doesn't have any neurological deficits, having had such a significant hit.
But it seems that you've cracked the bones in the spine, so I want to keep your head and back flat.
Len's fractured back is being protected with a collar. If one of the broken bones dislodges, it could crush his spinal cord.
Yeah, that's perfect, right? So we'll get the orthopedic surgeons in to see you, okay? Your job is to keep taking deep breaths in. If you don't take full breaths in and out, parts of your lungs won't fully expand and you can get a chest infection. And if your pain gets very bad, just put your hand up and we'll get you some painkillers, okay? All right, come on.
Len retired 4 years ago and regularly goes off-road dirt biking. But a generous gesture to a mate has changed his life forever.
I decided to hand my bike over to a friend and, I rode the four-wheeler, hit a ditch and just got catapulted off it and the thing just rolled, and when I stacked it, I couldn't feel my back and I couldn't move this arm, and I just thought there was something bad wrong. I knew something was wrong.
His son Jesse is on his way, while Len waits to hear if surgeons will have to operate.
But I shouldn't have been riding that four-wheeler. First time and last time.
back and head injury.
Dr. Michael's patient, Len, was airlifted to hospital after a high-speed quad bike accident in remote bushland. An experienced dirt bike rider, it was the 50-year-old's very first time on a quad bike, and it ended in disaster.
It's in my back. I don't know what's wrong.
The father of two broke his spine in 4 places, fractured his ribs and punctured his lung.
I guess they wouldn't give you the remote to adjust the bed just in case you wound up doing something.
It's now been 5 days since his trip to emergency, and Len is now recovering in a ward with son Jesse by his side.
I thought I was dead. I thought I was going to die. That thing rolled on top of me, that four-wheeler, like I was nothing and I was just a bag of potatoes, and that was the, 250 or whatever, 300 kilograms smashing on top of you at the same time. It's not good.
Jesse's grateful his dad survived and that his injuries aren't much worse.
It's very terrible what's happened, but I'm super glad that he's still okay. He's the best dad I could ask for. Without him, we would be... I can't even imagine, honestly. He's absolutely everything to me. He's my best friend, he's my dad. Yeah.
Fortunately for Len, doctors decided not to operate on his back.
I suspect Len will actually make quite a good recovery after this injury, but it'll be a long process. And I think with multiple broken bones, it's going to be a lot of pain and a lot of rehab involved. But I think he's come away quite lucky.
And what is Len looking forward to doing once he recovers?
Can I say this on TV? I'm so looking forward to scratching my bum. On my own, which would be good, yeah.
Senior emergency Dr Tom Rasgar is a 20-year veteran of the Royal Melbourne, and tonight he's working in ambulatory care, where people arrive with all sorts of injuries. His next patient smashed her pinky finger in a heavy metal gate.
I've never had anything like this happen before, so I think it's the first time in an emergency, so it's a bit overwhelming for me.
Tamaya grew up in Romania, and her childhood memories mean she's terrified about being in emergency.
Grew up in a communist rule, so obviously things were very limited in terms of anaesthetics. So you'd have dental work as a child. They wouldn't use much anaesthetic. Oh, I'm scared, yeah.
Often the emergency department is very noisy, very bright, high volumes of traffic going through. The combination of what's happening to you personally and then those environmental factors can actually, for some people, really make it a very distressing experience. And so what's happened? Sit up there.
Caught in the metal door. It's closing and...
Yep. What time did it happen?
Yesterday at 3:30.
Okay. Are you left or right-handed?
Right-handed.
And what do you do for work?
Look after the one. Just there on one.
Yep. How old's your baby?
5.
5.
He's a kinder, yeah.
Yep.
Keeps busy.
Now, how throbbing is that fingernail?
Continuous.
Okay.
Tamaya's husband, Reno, is worried for his wife.
Do you want me to make your whole finger go to sleep?
Yes, please. I want anaesthetic. Lots of it. I want to feel nothing.
Well, you feel the injection.
Yeah, but I won't feel nothing afterwards.
Well, you'll probably still get a pushing and pulling sensation when I'm doing something, but hopefully it won't be painful.
Okay.
All right?
Promise?
Sound good?
Yes,
Don't make promises.
Oh.
She's got a phobia. Yeah, no, fair enough. Everyone presents to the emergency department with, their own life experiences, but I try and take into account and accommodate their past experiences and their current fears, and hopefully it can be a matter of being able to reassure them that their worst fear is very unlikely to happen. So the tip of the finger's quite swollen, there's some bruising under the nail, and on the other side, on the pulp, there's some skin wound. So we'll do what needs doing to try and make her better in the long term. She's already had an X-ray that the triage nurse has organised, so we'll have a look at that. So she's pretty anxious. This is the worst part of what I'll do.
I mean, I just don't want to feel pain.
General anaesthetic, I reckon, previously.
That would be the best.
In a nearby treatment bay, Dr Tom Rasgar's patient, Tamaya, is considering extreme measures. being knocked out for the treatment of her squashed pinky finger.
No, it's not funny, they'll be the best.
The emergency first-timer has a pathological fear of pain.
All right, so the anaesthetic goes here. All right, so I'm just going to give the skin a bit of a wipe. All right, so this part does sting.
I don't have very good pain threshold.
All right. Keep breathing away through. Should just start to feel better now. Okay.
Dr Tom has Tamaya's x-rays.
It's split down the middle, I reckon.
So there's your hand like that.
Yeah.
So there is a little crack through the bone.
Oh, there he is.
All right, but it's nice and straight.
Okay.
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 So there you go. But because the skin's broken,
Yeah.
we do get a bit more worried about infection.
Yeah.
Tamaya's x-ray showed an undisplaced fracture with the open skin on the pulp side of the finger. If the bone then gets infected, then that can be a very significant problem. If you squeeze it, does it hurt?
No, not so much.
No, good. So if I do something and it hurts, let me know, obviously.
Oh, I think I'll let you know, don't worry.
First thing we're going to do is give it a nice clean, and then I'm going to see if I can get some of that blood out from under the nail, because that's the thing that's causing that throbbing pain.
Where does the blood go underneath the nail so much like that?
Because the broken bone bleeds and it's got nowhere to go.
Okay.
Part of what we're trying to do as emergency department staff is to try and alleviate some of those anxieties and fears. Can you feel it?
No.
Oh, there you go. That already looks a whole lot less swollen, doesn't it?
Oh, yes. Oh, my God, what did you do?
Got the blood out from under the nail.
There you go. Oh, wow.
What I'm going to do is put a dressing on.
Yeah.
And then we're going to put a splint on the end of your finger.
Yeah.
And then we're going to get you in to see the plastic surgeon just to make sure that everything's healing okay.
Yeah.
And in the meantime, given the fact that that has been open to the world, we're going to give you some antibiotics to hopefully make sure it doesn't get infected.
Yeah.
Okay.
And I won't lose my finger.
That would be a bad outcome.
Dr Tom's patient Tamaya went home with her finger splintered and returned later for surgery to repair the damaged nail bed.
I don't have very good pain threshold.
And she's recovering well after her first emergency experience. Over in triage, 58-year-old electrician Roger has arrived with paramedics after falling through a ceiling manhole.
So he's fallen through the roof onto the ground.
Yeah, looks like the ladder slipped out from underneath him.
Nurse Lucy Stranger is assessing patients this evening, and her job is to find out if Roger needs immediate attention.
Hello, can you open your eyes for me, matey? I'm over here. I need to check his level of consciousness. And if that's at the highest level, which is at 15, that's brilliant, totally orientated. But if it sort of drops off, it can be that there's something going on internally. Roger. Roger?
The tradie is showing worrying symptoms and is being taken straight to trauma, where Dr George is standing by.
Roger, I'm George, one of the emergency doctors here. Clearly, you look like you're not feeling too crash hot today.
Where's that pain, mate?
Roger's a 58-year-old Sparky. He had an unwitness fall. He's got a graze on the inside of his right bicep, which is consistent with having his arms above his head. He's got a sore left shoulder, sore left hip, which is not complaining of any headache or cervical neck pain. It's always been lumbar pain.
Excellent, thank you very much. Fall off a roof from several metres up, you impact usually on concrete with absolutely no, safety device to prevent injury. The kinds of injuries I'd be typically expecting is chest, usually some broken ribs, some lung contusions, maybe some spinal injuries, maybe a pelvis fracture, and maybe he's got a limb or two that's broken. Can we get in some oxygen, thanks? Yeah.
Best mate John was with Roger when he fell.
We're at my son's house, just trying to finish off so they can shift in. And he's had to go up in the roof and put his bladder up in the manhole. And I think as he was walking up, it slipped out and he's obviously fallen down and done a bit of damage to himself. Yeah, a bit of a shock.
Can you feel me touching your feet? Yeah. Any numbness or tingling? Nah.
Roger can feel his legs, but it doesn't rule out spinal injuries.
Yes, if there's pain, or no, if no pain.
So we're going to try and get some x-rays. So if anybody's not wearing lead, can we start migrating out of the room? Thank you. So his x-rays actually weren't too terrible. Looked like he might have some left-sided chest injuries, but you don't get a lot of detail on your simple x-rays, so...
John will be here for when you get back from your scans, okay?
And while Roger seems more alert, he could still be seriously injured.
What we're going to do now are some CT scans all the way from the top of your head all the way down to the bottom of your pelvis. One of the things that's the most disturbing for all emergency practitioners are talk and die patients. So the idea that somebody seems to be well and then deteriorates. They're a rare population, but they really stick in your mind. And, you know, if you've ever seen a situation like that, you become very vigilant about making sure, yep, this is probably just the same as all the other trauma patients, he'll be just fine. But I need to make sure we're not missing any life-threatening injuries. He's going to have broken something, probably a few things. So we will do a CT because he's landed on his head and his abdomen and his pelvis because that's where most of his pain is. And at the end of that, we'll have a hell of a lot more idea of exactly what his injuries are. And then we'll be able to come up with a plan of how we make him better.
Okay, starting hot injection now, nice and still.
Please breathe in and hold your breath. Pelvic fracture, let's see. Any pelvic fractures? This looks alright. Looks pretty good. Yeah. No pelvic fluid, which is always a good start.
Roger's pelvis looks okay, but injuries to his back are severe. There may be bone fragments which could sever the spinal cord and lead to paralysis.
So, Roger.
Yes.
I thought I was for sure going to see some pelvic fractures, but I couldn't see any, so that's really good.
That's fantastic.
We're not yet out of the woods, though. Our radiologists will go through it with a fine-tooth comb.
Mm-hmm.
So we'll know over the next couple of hours that we're not missing anything.
Yeah.
Roger's future as a self-employed electrician could be at risk.
Yeah, Roger. You're not bad, John. Appreciate you coming in.
Roger was helping his mate John do some work on his son's house when the accident happened.
Sorry I fell. Oh, Jesus.
Just as long as the pain goes away.
He's a good man, a good friend.
That's what I'm looking for.
Just in the hips and bottom of the spine.
58-year-old Roger is still in severe pain after falling through a manhole. He's waiting to find out from Dr. George how badly damaged his back is and whether he'll walk again.
Now, so Roger.
Yes.
The radiologists have had a chance to have a look with a bit more detail, and they've spotted that you've managed to break a couple of bones in your back. So one of those is a bit higher up, kind of about the level of your shoulder blades. And that one, to my eyes, as a non-spinal expert, looks like it will heal up fine. There's one a bit lower down. That one does look like it'll need surgery to stop the free bits of bone wiggling around it. We're letting the orthopaedic spinal surgeons know about you to help come up with a plan for you.
Okay, thank you.
Okay? Roger's got what's called a burst fracture of his vertebra, so the main part of his vertebra has essentially exploded. And that's, you know, what we would call an unstable spinal injury. So that means that bony fragments can shift around and are unlikely to heal rapidly and well without needing some surgery.
For Roger, his worst fears have come true.
It's a day-to-day reminder that life's fragile and, somebody can be perfectly well in the morning and not a couple of minutes later. It makes you appreciate what you've got and to make the most of what you have.
Dr. George's patient, Roger, survived his 2.5-metre fall from a manhole. The self-employed electrician broke his back and needed spinal fusion surgery to repair the damage. Roger was released from hospital a week later, but sadly hasn't been able to return to work. An air ambulance is landing on the hospital helipad with a man who's been injured in a freak car accident.
Guy in a four-wheel drive and has crashed. He's an 180-kilo gentleman, apparently, was trapped in the car and had to be freed by the SES. And he's got back injuries. That's all we know so far.
Dr. Jenna is standing by to treat 38-year-old Brad. Pictures from the crash scene show it's a miracle he's alive.
Stay nice and still, hands on your chest, let us do some work.
Whoa, head spin.
I'm Jana, I'm one of the doctors. I'll be looking after you.
So Brad is driving a car today at around 60 k's an hour from what we can gather, and it appears like a branch or a tree has fallen down across the bonnet of his car. He's then gone down an embankment, 20 metres down the embankment, smashed through the several trees and come lodged up against a tree on an angle like that. He remained trapped in the car for probably an hour before we got there. He walked out of the vehicle, no issues, then complained of some lower back discomfort. And just as we've made him, he's complained of some soreness in his right wrist as well. Thank you very much.
Adrenaline is our fight or flight hormone. It's designed to help us survive, and it can mask your pain initially. That's why you hear about all these patients getting up and walking on broken ankles or dislocated ankles and spinal injuries and not feeling the pain until later on. And so Brad could have a head injury. He could have, pelvic injuries or abdominal injuries.
I live with Mum.
Okay, all right. Does she have a look at the ankle?
No.
Do you care for her?
Yeah, sort of.
Okay.
With the possibility of serious injuries, the hospital is contacting Brad's mum. A former Country Fire Authority volunteer, big-hearted Brad spent his life looking after others. But now he's the one who needs support.
The CFA, they're amazing. Working in emergency services is not easy. I'm quite lucky that it's my job and, I get paid to do it, but people who volunteer to do it I think are very special.
Can you take a big breath in for me, Brad?
The ultrasound is the first step to finding internal injuries, but Dr. Jenna is having difficulties.
And again?
Being larger means that it can be harder to tell where the injuries are because you're having to penetrate through a lot more tissue. There's some injuries that can be time critical, and in a car accident, that force increases the likelihood of major injury, especially in the chest to the great vessels. And the one in particular we worry about is the aorta. It's quite a serious injury and the mortality is really high from it.
Big breath in. Abdominal fast is negative. The chest is clear.
Finally, she can rule out bleeding to his abdomen and chest.
So, do you remember all of the accident? No, sorry, just try to keep your head still.
No.
Yeah. So, what is the last thing you remember?
I don't know.
You've got some bruises on your face, so we know that you'll hit your head, and you might have lost consciousness for a while, but we're not sure. Yeah. Okay.
So there's different types of head injury. They can get bleeding around the brain, and sometimes these patients will have long-term brain damage.
1, 2, 3, and roll.
All right. Any pain here?
No.
Yep.
Starting. Oh.
Okay.
It's all in the lower back.
Yeah. So,
In the-
lower T-spine, upper spine.
Yeah, it's all in here.
The fact that he's got spinal tenderness, he's potentially got a brain injury, and also he's a difficult patient to assess at the bedside with our ultrasound. All those factors combined means that he gets a full head-to-toe scan to rule out any major injury.
Injection now, warm feeling.
In emergency, Dr. Jana Alexander's car crash victim, Brad, is in the CT scanner. It's feared the former CFA volunteer has multiple injuries after surviving a shocking car accident.
X-ray after this. Yes, please.
While the CT scans are assessed, he's also X-rayed.
Just turn your hand out like that, Doc. I just noticed a little irregularity or an old injury in the knuckle. If you actually look at his finger, it's quite deformed, so you wonder whether it's new or...
Someone chopped it off with an axe.
When you were much younger?
8 years of age. I said, Mum, I've cut my finger. She goes, I'll get you a Band-Aid. I go, I need a bit more than a Band-Aid.
Probably need more than a Band-Aid.
Luckily, no new fractures are found. And on the way back to the trauma bay, results from Brad's CT scan are ready.
The CT scan can see he has got a chance fracture of the L1 vertebra. So it's not as bad as it could have been, but it's something that needs orthopedic input.
Even though Brad's back is fractured, his spinal cord is intact. So rest and rehabilitation should be all that's needed for a full recovery. Brad, who's devoted almost half his life to volunteer firefighting, looks at the photos of his own rescue with a sense of relief.
They did a good job. I don't know how long the rescue took to cut me out. Don't remember much of the accident.
His mum, Janice, feels lucky to have her son alive.
Shocked.
Oh, HP.
Former CFA volunteer Brad cheated death when a tree fell onto his car, forcing him to career off the road and down an embankment. Despite fracturing his lumbar spine and breaking a tooth, he was discharged from hospital 4 days later.